my dear nursing students and future nurses. My name is Ling. I am a med-surg nurse that almost had 3 years working experience. Recently, I just finished my 4th assignment on a trauma floor. So at that assignment, I got to see a lot of trauma fractures. So I create this video and help you guys to pass your fracture nursing exam. And this video is a part 2, and please check out the part 1 video to practice more of the fracture Nclex-RN questions. A patient with a long leg cast reports pain in the toes. The nurse discovers that the toes are pale and cool to touch with intact pulses and minimum neuropathy. The findings indicate that the patient might be experiencing what? 1. Osteomyelitis. 2. A fat embolism. 3. A pressure ulcer. 4. Compartment syndrome. The answer is option 4. Compartment syndrome is the progressive compromise of neurovascular function of the tissue in a confined space, such as a cast. It might also result from a circumferential inflammation around the extremity. The earliest sign is paresthesia, followed by pain. Pressure results from edema, polo, and the abscess of pulse. A pressure ulcer is caused by decreased circulation due to pressure, tissue hypoxia, and destruction. Osteomyelitis is an infectious process within the bone. A fat embolism is an acute event in which fat globules release into the circulation, obstruct pulmonary circulation. It's seen with fractures of long bones such as the femur. Okay, next question. A nurse cares for a patient who have a fractured femur. During 48 to 72 hours after the fracture, the nurse should monitor the patient for development of what? 1. Pulmonary embolism. 2. Renal calculi. 3. Muscle atrophy. 4. Bone demineralization. The answer is option 1. Pressures on bone marrow can mobilize fatty acid and development of fat globules in the bloodstream. Those fat globules travel to the lung and become large, causing the pulmonary symptoms. The rest of those options, like renal calculi, muscle atrophies, or bone demineralizations, are all potential complications of immobility. However, they will develop much later than 3 days after the fracture. Okay, next question. A nurse is teaching crutches walkings to a patient who had surgery of the knee. On which part of the body should the nurse instruct the patients to place weight? 1. The biceps. 2. The axillary region. 3. Palms of the hands. 4. Both lower extremities. The answer is option 3. The palms of the hands. The palms should grip the hand grips area of the crutches and should bear all the weight. Option 1 says the bicep. This is very unsafe. Option 2 says the axillary region is a very popular wrong concept. A lot of patients like to just lean all their weights on the axillary area, which can cause nerve damage. Option 4 says weight bearing on the affected lower extremity is not allowed at first. Okay, next question. The nurse provides discharge instructions to a patient who has undergone total hip arthroplasty. Which statement by the patient indicates understanding of the instruction? 1. I will walk at least 2 miles a day after I got home. 2. I might get back to work as soon as I feel that I am able. 3. I have to do physical therapy exercises several times a day. 4. I should take frequent bike rides to increase my activity and joint flexibility. The answer is option 3. After hip arthroplasty, the patient must perform special design exercises to help regain muscle strength. Care must be taken to prevent dislocation of the prosthesis and to prevent fatigue during the recovery period. Walking 2 miles per day and taking a bike ride would put too much physical stress on the patient. The patient should take slow but steady progress. So option 2 is the wrong answer. Okay, next question. The patient is post-operative for a knee replacement and is prescribed meperidine, also called Demeron, a narcotic analgesic, by patient-controlled anesthesia pump. Which instruction regarding pain control should be the nurse teach the patient? 1. Notify the nurse when needing pain medication. 2. Press the buttons on the pump when the patient feels pain. 4. Have another push the button frequently for the patient when the patient feels pain. 4. Use the pain medication sparingly to prevent narcotic addiction. The answer is option 2. The patient can push the buttons in the PCA pump whenever he or she feels pain. There is a setting that we can set if she or he feels pain. For 4 hours or 2 hours, lockdown programmed into the machine to prevent overdose. Option 1 is wrong. The patient does not have to notify the nurse because the patient is able to control its own pain medication. But for nurses, we should assess the amount of relief the patient is obtaining and any complication. Like if you see the patient's respiratory rate is less than 8 times a minute, you might think the patient is overdose. Option 3 is also wrong. No one should push the button for the patient to receive medication. What if the patient is having no pain, but someone pushed it for the patient? The patient will end up with an overdose. Option 4 is also a wrong answer. The patient should not be concerned with narcotic addiction. The medication should be discontinued before this becomes a problem. Okay, next question. A patient is admitted to the trauma floor with a left elbow fracture and a brace is applied. The nurse determines that teaching about the brace has been effective when the patient made which statement? 1. The brace should act as a tool that maintains immobility for my broken elbow. 2. The brace will allow for movement. 3. The brace is only for comfort. I don't have to wear it if I don't want to. 4. The brace will help to prevent infection. The answer is option 1. The purpose of the brace is to maintain immobility and prevent direct contact. Option 2 is the opposite of option 1, so option 2 is the wrong answer. Option 3 is also wrong. It says the brace is only for comfort. I don't have to wear it if I don't want to. A lot of my patients on the trauma floor that my last contract, they don't really understand the importance of the brace. They choose to wear it or not, or when to wear it. However, that is not right. Patients should follow the doctor's order, especially patients with spinal injuries. They really should wear their braces when they get up from the bed and do physical therapies. I'm not going to lie, some body braces look ridiculous big, but our nurses, we need to do our teaching to make those patients wear those huge braces to protect them. And a brace will not help to prevent infection. Okay, the next question is a matching question. Okay, next question. Which statement made by a patient who has a fractured hip indicates understanding of hip precautions? 1. I can't fully extend my leg at the hip for 1 month. 2. I won't be able to cross my knees for at least 12 weeks. 3. I can put weight on affecting leg as long as it doesn't cause pain. Or 4. I can flex my hip but no more than 90 degrees for up to 2 months. The answer is option 4. Hip flexure of more than 90 degrees must be avoided for up to 2 months. Option 2. Adduction past the middle line must be avoided for up to 2 months, so the knees cannot be crossed for 2 months. Weight bearing is restricted and doctor's orders regarding extending of the restriction need to be followed. And there is no restriction on extending the leg. Okay, next question. A patient has fallen in the bathroom of the hospital room and reports pain in the upper right arms and elbow before splinting the injury. The nurse knows that the primary management of a possible fracture should include which action? A. Elevation of the arm. B. Application of ice to the side. C. Take the patient up from the bathroom floor and held back to bed. D. Neurovascular checks below the size of the injury. The answer is D. Vascular and nerve assessment, such as pulses and sensation and motor function, should always be checked before and after splinting. Elevations of the arm as option 1, application of ice as option 2 should be done after the extremity is splinting. In real life, you don't just take the patients out from the floor as option 3. Because you never know where else has been injury, maybe his or her head. You always need to do a set of vital signs and call the provider to report this incident. And you have to do a lot of extra paperwork because of the patient have fallen on you. It is a nightmare. Don't let your patient fall. Okay, last question. When planning care for a patient with a fractured hip, the nurse would plan to monitor for which common complications? Select order apply. A. Urinary tract infection. B. Pneumonia. C. Candidiasis. D. Herniated nucleus pulposus. D. Thromboembolism. The correct answers are B and E. Pneumonias and thromboembolisms are complications related to immobility and are significant risks in patients with fractured hips. Urinary tract infections and candidiasis may occur, but patients with fractured hips are not at particular risk for them. Option D is a problem of the intervertebrate disc that may be the result of degeneration or trauma of the spine, not hip. Alright guys, and that is it for today's video. Please go to check out the part 1 of the fracture video. I will see you in next one. Bye.